Philadelphia at New England tonight. Both Nick Foles and Tom Brady are due to play. The Jets are at Washington. Giants rookie running back Saquon Barkley did not practice again today. Mild hamstring strain the problem. He did some light running on the side. Titans tight end Delaney Walker is being evaluated after an apparent toe injury at practice today. Brandt Snedeker shot a first-round 59 at the PGA event in Greensboro. He leads by 5 strokes. Sergio Garcia is 7 back. In Major League Baseball, the Yankees at home are getting shut out 2-0 by the Rays, and all-star Blake Snell in the bottom of the 6th. Coming up, the first of a doubleheader, Mets at Philadelphia, the second game a makeup of a rainout. I'm Steve DeSager.
Hello, Cynthia Tieche here with Dr. Tieche. Coffee Talk with Dr. Tieche. How's it going today? Good?
Fantastic.
You're having a good day?
Mm-hmm. Good week.
A good week, yeah. It's a good week because all of the kids are back in school now, I'm pretty sure. Yes. Yes. Everyone get back in their routine. No more excuses, right?
Well, that's a two-edged sword, being in a routine.
Why? Yeah. Oh, yeah.
Well, yeah.
Yeah, sometimes it gets old, but it is nice when you can go to the gym every morning and get all that back in order. And that's what I want to talk about today, is getting back in the routine of going to the gym, meal prepping. So you're done with all your vacations and your boating and eating and all of that. So now it's time to get back on track. Eating good, ketosis, no more fast food. Get ready, whatever day it is for you to get ready. Prep your meals. Meal prepping is really helpful.
Very helpful.
Very helpful. I mean, it takes the excuse out of, oh, I didn't have time, so I had to go through the drive-thru. No, you don't. I mean, it's not that hard, especially if you are eating in ketosis. That's very easy to meal prep. Just throw a bunch of steak or chicken and some Tupperware and you're done, right?
Yeah.
Just throw it in there.
Throw it in there. Yeah.
Throw it.
Yeah. Yeah. Yeah.
So, whoa, I almost lost my mic. So that's really my tip for this week for weight loss is meal prep. Get back in a routine of whatever class or whatever workout, whatever gym or walking group you might be in. Get back on it. Get back in the routine. Your kids are probably going back to their sports. You know a good thing I never did, but I always wanted to do was, when all the kids are at their practices and all the parents are just sitting there, that's such a great opportunity to do like a little workout. And every once in a while you'll see a parent doing that. But if you are one of those parents that are watching basketball or football or soccer or something outside, grab some of those parents and go start walking or doing a little workout. You're just sitting there, right?
Well, many of them are watching their kids, so how are you going to work out?
They're not watching their kids, they're talking.
Yeah, that's true.
But you can watch your kids in squat.
Mm-hmm. Yeah.
Sitting on those bleachers is not comfortable anyways. No. That's bad for your back. So do some lunges, do some running up and down the bleachers.
Oh, right.
Yeah.
Okay.
You can get a workout. You don't just have to sit there.
Yeah.
Yeah. Huh.
Pull-ups on the bleachers.
Pull-ups, yeah.
Yeah, sure.
Yeah. Like Rocky. Like my favorite.
I don't think he did pull-ups on the bleachers.
No, but not pull-ups. He ran up and down the bleachers. Remember?
No, that was stairs.
Stairs, bleachers. It's the same thing. I love Sylvester Stallone. If you know me, you know that. Yes.
That's why she married me, because I'm the closest thing. I'm the closest thing in Ocala to him.
Of Sylvester Stallone.
In every other opposite way.
Yeah.
Yo, Cynthia.
Do you have any tips to go along with that? Everyone's trying to lose weight. I don't know anyone that doesn't want to lose at least 5 pounds.
Yeah. And it is important. It is important. This is really the hectic time, and we're already seeing people starting to get stressed and freaking out because, getting back into that routine. And, the first couple of weeks for the kids are going to be easy because, everyone's hyped up. But then as that newness wears off and people start getting a little tired, that's when the junk creeps in because it's just quicker. Meals are going to be quicker, snacks are going to be quicker, and it ends up being that way for everybody. Particularly if your kids are doing after-school activities, which seemingly most people's are, then the last thing you want to do is come home and start cooking a meal, and everyone's just dead tired and wants to shove something in as quickly as they can and get ready for bed or something, or homework. So that's the time when, it's important to have something planned. So that's, weekends
I
are a good
noticed
time.
eating, being really trying to be strict on ketosis lately, is that if you are like, I will not go through a drive-through, but I would run into like a little store. But eating ketosis, the like quick already made snacks are crackers and carbs. So you do need to think about that and get planned beef jerky or whatever your little snacks might be, because there aren't as many keto kind of foods easily to just grab off the shelf, obviously, but that's way more fresh.
Well, you do have to look, because honestly, there's a lot. But you just have to look in different places. There are little containers of just nuts and cheeses that are made up, and those are like by the
Yeah,
little
that's right. There are some
Lunchables,
of
and
those.
then there are, like in the deli section, there's they're already pre-made up things of rolled up ham and cheese that are just little snack things, and salami.
Yep,
And cheese
head
and
to the
stuff
deli.
So that's where the deli will be your friend for quick food.
Yep. So, before we get started in too much and lose our time, we have a couple things coming up. So mark this down. We have a little blood drive coming up to the clinic. We, from One Blood on September 6th, which is a Thursday, from 12 to 5. You can call and schedule to come in, or you can just pop in that day, and we'll be taking all of your blood for donations. So,
And when we want to offer this, we're going to start trying to do this on a monthly basis at the clinic, to have them come in there to draw, because many of our patients, as some of you may or may not know, when people are on hormone replacement or hormone therapy, testosterone can sometimes increase your red blood cell count. And so, as opposed to just taking someone off of it, what we end up doing is having them donate blood. And so it's kind of a win-win. The patients get to stay on their therapy, get to feel great, and then we're helping, the county with their ever requiring massive blood needs. And so, we've always recommended people to go to there, and some people run out of time, but they seemingly, a lot of them are coming to our clinic for shots and other stuff. So we want to make it even more accessible for them to kind of take more of the excuses out of their life. And so we're going to start trying to do it once a month. But if it gains traction and there's a lot of people, then we'll do it as often as we need to, because we're just going to set up one of our rooms as a blood draw room, and to do that. So I'm going to be one of the first people doing it, because I want to do it myself. And so I know that, I hope that a lot of people who are needing to do it come and do it, because we're going to make it really easy for everybody.
Yep, a nice environment, a comfortable place, and you're doing a good deed. On August 25th from 10 to 2, we have an open house at Recharge Clinic. That is a Saturday.
Saturday.
Yes, not this Saturday, next Saturday. You can swing by. We're going to have, of course, specials and just little consultations if you need, or if you've never been there, or if you have been there and you love getting our specials, then definitely come by. So that'll be fun. In September, later on in September, we also have a Botox at the Boutique coming up. We did something similar like that last month, so we're going to be doing it again next month. But I'll give you more information on that when we get closer to it. If you look on our website, you'll have information on the open house there. And then the blood drive day, you can just call or swing by. If you want to schedule, you can. So, I have some questions for you today.
Well, I wanted to.
Oh, you want to butt in?
Well, I had a couple of.
Go ahead. You go first.
Encouraging patient stories.
Oh, okay, good.
So we've had some people who, I just saw this week, two patients, to be exact, who came and started and, have been with us, for about 6 months, and who started really the whole thing. They're middle-aged guys who developed their paunch and kind of gotten out of shape, having executive lives, not a lot of activity, and needed to lose some weight. So basically they started dieting, exercises, got on hormone therapy, primarily testosterone pellets, and both of them are just doing fantastic. One has lost 30 pounds and one's lost 45 pounds, and they feel like new men. I mean, basically they look totally different, had to buy new clothes. They're super excited, super energetic.
Probably feel like new men.
Yeah, and so that's a lot of weight to lose.
That is.
And both of those guys were ones that had kind of the big bellies, and so for them to not see a belly on them was really pretty.
So
amazing.
what did they do exactly?
They both actually went on a keto-based diet, so a very low glycemic diet, and working out, with a calorie restriction as well, working out, and not really working out crazy amounts, just starting a workout program, because neither of them really did work out, and then allowing the hormones to really kind of help their body get better and feel better and burn more calories. And so really it's really been pretty impressive for them.
Why is it that guys whose testosterone is really low, that they do end up carrying more belly weight, and getting that testosterone regulated helps them lose weight? Why is that?
Well, they just end up getting to what's called like a metabolic syndrome, which is where people get more abdominal fat, and it's not everyone gets it there, but a lot of my guys get it. They get a lot of what's called visceral fat, and they get fat in their omentum, and that pushes out their stomach quite a bit, and then they get fat on top of the skin there as well, and that's just primarily where they congregate it. Their muscles are not having the same amount of stimulation from testosterone, so they are not burning calories at the same rate, and so basically they've been eating at a normal rate or higher, and so it's more in than out, and so basically they just start storing, and that's what they're doing. And so what happens with those guys is, in a lot of that area of fat, they end up producing more estrogen. And those fat cells. So then they end up feeling a little bit worse. And so estrogen kind of even provokes more fat storage. So it becomes kind of a vicious cycle for those guys. So interrupting it helps them starts the process, and then they feel better, and then they continue on, hopefully.
Yeah, because this is what we see every day, is them with low testosterone. We can almost spot them when they have that belly fat like that. And then that just melts away. It really does. As long as they're trying. Can testosterone affect moods? So, there's that people think that if you're going to get on testosterone, you're going to be in a bad mood, or no, I don't need testosterone, I'm already cranky. Can it make people cranky?
Well, that's a big misconception, that testosterone can make people aggressive, make people want to fight more, and things like that. So the short answer is no. But there is some little caveats within that. So low testosterone actually makes people more moody than higher testosterone, because they generally feel bad. They're generally depressed, have a little bit of lower self-esteem, and not as much self-confidence. And all of those things are really hard to quantitate as far as medically, but people know that these things are all the intangible things that men experience, and women too, when they're testosterone. So they just don't feel themselves. So when we increase it back up into the normal range, or to the range that they were when they were younger, which is our target goal, a lot of that comes back. Their self-confidence comes back, their motivation comes back, and some more assertiveness or confidence may come back. And so that doesn't necessarily come off as aggressiveness. It can in some people, and we have had a couple of people who did become a little bit aggressive, but it turned out that those people, when they were young, were kind of aggressive people, and so what happens is it tends to bring you back to what that was at that point. And we use some herbal supplements, and it really actually helped calm all of that down. But I'll get back to that, because there's some more that I really want to talk about that. Because
we're not done with that. That's very important that we finish that. We'll be back.
You cannot ignore Facebook. Facebook live streaming.
The GOAT FM.
Hi, Hi, this is Cynthia from Recharge Clinic. If you are struggling at all with your weight loss, you need to come in and see us. 47 Southwest 17th Street in Ocala, Florida. Check out our website, rechargeocalaclinic.com. That's rechargeocalaclinic.com. rechargeocalaclinic.com. We can help you. We will get you through whatever weight loss struggle you are facing.
Hi, this is Lauren Gibson from Lauren Gibson State Farm. A lot of people remember to insure their auto and their home, but not their life. If you have someone that relies on your income, you need life insurance. It's as simple as that. Life insurance really should be called love insurance because it's for those that we love. At Lauren Gibson State Farm, our mission is to protect and provide for you and your loved ones. Please visit my website, insuredbylauren.com, or call us at 352-355-3340.
BJ Trophies, so much more than just trophies. Now offering in-house production of decals, signs, and banners. Let them put your logo or design on almost anything. BJ Trophies also has traditional wedding, baby, and anniversary gifts, plus custom 3D crystal pieces, jewelry, and engraving. BJ Trophies making one-of-a-kind awards for your one-of-a-kind events for over 30 years. Don't forget, BJ Trophies now offers banners and decals for your business. Stop by BJ Trophies on Northeast Jacksonville Road or call them at 732-2249. That's 732-2249 or online at bjtrophies.com.
Paper products are an essential part of any business, big or small. Concord Print Shop in Ocala supplies our personalized letterhead, envelopes, business cards, and so much more. Coupled with the unmatched quality of their work, the personal customer service sets Concord Print Shop apart. Call Concord Print Shop today at 352-629-0736. That's 352-629-0736. Concord Print Shop in Ocala. We make you look good on paper.
When you are looking for lawn care, pool services, or cleaning services for all your commercial and residential properties, there's only one call to make. 352-598-3720.
Touchdown!
I'm Trey Adams, the owner of the Touchdown Group. I'm proud to be a business owner that has had 4 generations who have called Ocala home. Touchdown Pool Service, Touchdown Lawn Care, Touchdown Cleaning Services are all licensed and insured companies. And when you need our services to tackle your projects, one of our trained professionals will provide you with a free estimate. When you call 352-598-3720, the Touchdown Group, you know you made the right play to stay in the game. Like us on Facebook or look us up online at thetouchdowngroup.com. At the Touchdown Group, we go the extra yard. Touchdown!
This is Justin and Magic Matt. Dang it. Keep going. Join us at 8 a.m. on Monday mornings for Unwanted Opinions, sponsored by the Touchdown Group.
Servicing all your pool, lawn, and cleaning needs. Score big this season with the Touchdown Group.
I'm not doing a show with a Magic Matt.
Why not?
Then you're going to be known as Magic Matt.
Someone sounds a lot a bit jealous right now.
If you're into weird stuff on the internet, find our webpage, thegoatfm.com.
And we're back. Cynthia Tieche with Dr. Tieche. We were just talking about testosterone therapy. Does it make you moody?
So finishing back up, so by and large, most people feel much better after they've had their testosterone optimized. And in fact, their moods improve. They become generally happier, more confident. Actually, it has a very calming effect to most people as far as that. I mean, so it's not sedating. So a calming is kind of a strange word to use because people feel like, oh, it's going to make me sleepy, but it doesn't. It just kind of is, just makes you feel a little bit more mellow.
So you're referring a lot to men, but women, I mean, I've heard a lot of stories from women, me, myself, especially like just not having as short of a temper.
Correct. So it does actually, in women, one of the things that it's really been shown to do is kind of level out some of the moodiness up and down. And that does help with that. Yeah, that's been really been very helpful for many people, many couples, for sure.
Yeah. Yeah. I mean, I definitely noticed it. I mean, I've never been a moody
Oh, you just only have one mood.
Oh. Hey.
So
not always. But I am a edgy or like a short-tempered person, probably. I guess is that the word you? No, it's probably not the word you'd use.
Not the word I would use.
But it has.
But we're on the radio, so I can't really
quite
use
a bit. It has helped. It's definitely helped me. Do you think it's helped me?
Yes.
Yeah. And when it's wearing off, we know. But not just me. Like I have a lot of women that have been like, "Oh my gosh, I cannot believe, like, that I ever lived without this, or how did I not murder someone before?" Really, like, and then you realize, wow, I can't believe I was acting that way all the time. Like you don't know that you're doing it, but once you start feeling better, then you look back and go, "Oh, wow, those flip outs probably weren't necessary."
Yes.
So, and the same for men, but women too. So it really does help level. I don't know, just like I guess it just really helps your temper, I think. So definitely if people go, I've had women go, "Oh, I don't need testosterone. I'm already, witchy as it is." I'm like, "Oh no, actually you probably do need it because it will help that." And I think people don't know that, and that's a big deal, and people should know that it helps that. And you're in that mood because it's too low. And so getting it right will help, and you'll have more friends, and people will like you better.
And you feel better. I mean, you
feel
will
like
just
a million times
really
better.
feel a lot better.
Yep.
So, that's the answer to
So
that
my
one.
question, does it affect your moods? Yeah, in a good way.
Yeah.
In a good way. So, I have another question, but did you want to start on your topics? My other question, it could be long, my answer, or your answer. Well, I want to talk about porn. Okay?
Sure.
So, I mean, maybe there's some women that like their husbands or boyfriends or whoever watching porn, but I think a lot of them don't. And women, you're going to like what I'm about to say. So, porn is true or false? Can porn cause erectile dysfunction?
Absolutely.
Yes.
Isn't that crazy?
Why?
And so what happened is, when porn first became as popular as it was, for older guys, I mean, we were used to Playboys and Penthouse, and that was really our only exposure of just kind of seeing boobs. And then it was a little more difficult to see porn. And now it's just, you just click on the wrong word and
kids are watching porn.
I mean, you accidentally click on ball and, it's already, flapping in your face. So people, it's very addicting. So people watch it, and guys and girls, and for whatever reason, whatever the reasons. But it is addicting, and people unfortunately, some guys spend a lot of time viewing it. And although it would seem harmless, and it would seem as though, well, it's no big deal. Unfortunately, the reality is, I mean, there's been really quite a few studies that have shown that it really kind of reroutes the wiring in your brain and how the dopamine and all of the receptors are firing, so that basically guys stop really kind of getting pleasure from real females. They're one that might be right near them, and are getting kind of an internal pleasure from watching porn, even though they are not really orgasming and all of that kind of thing. And so what happens is, when you are faced with a live body, things aren't working properly. You're not getting that same stimulation because it's not what you had. And this has really been a problem for younger guys, in their 20s, but I see it in people in their 30s and 40s too. And that's one of the things that I ask people when we're kind of working them up for that, after we kind of see what medications they're on, what medical problems they have, hormone imbalances. And then that's the thing I ask them next, like, how much do you watch? And it's surprising.
So they're coming to you, they're saying, "I can't get an erection, I don't know what's wrong." You kind of go through the checklist of what it could be, and then sometimes it ends up being that. So sometimes their testosterone and everything could be working exactly right, but then you get to that question, and that's what it is.
Yeah, it is, because sometimes they're not forthcoming with that. And so, we'll go, okay, these are the things that we need to work on, and we'll kind of go through them step by step, because all of them have to be fixed for everything to work properly. So it's not really just any one thing. If someone has a super low testosterone and they watch porn, I'm not going to say, well, stop watching porn, you're going to be better. Probably will be somewhat better, but not entirely. So you have to kind of do all of these things, and so when you get to getting things corrected, now all of a sudden, well, things are still not working, well, then you have to delve deeper and then really start exploring, okay, listen, what other kind of things are you doing that maybe you weren't entirely honest with me? Illicit drugs, that kind of stuff. Guilt, are you doing some kind of behavior that you might feel guilty about? And
a lot of times it is mental.
And it's mental.
Mm-hmm.
And so there's a lot of stuff that comes out about that. But anyway, back to the original question, that porn is a big problem. It's a big problem for young guys who, it ought not to be a problem for at all, and then middle-aged guys. And so it's very insidious because it doesn't seem like, how could that really hurt you at all? You're just watching something, but
basically they're being desensitized.
They're being desensitized. And it's
interesting.
It's really an issue. So really, you have to go off of it. You have to stop really kind of watching it. And
I mean, what if someone really had been watching it for a while and they are desensitized and they're having ED issues? I mean, how long could it take
it
to
takes a little
get
while.
back?
It's not
months, years.
Instant. Well,
Depends.
probably months. Probably months. Yeah. Because you have to kind of go back to the other way.
Wow.
Yeah.
Interesting. Well, that's all I got for you today.
Okay.
What you got?
So I wanted to talk about something that's I've mentioned before and we've talked about before, but now that school is back and all of us who have teenagers, just to throw out some stuff that's going to probably be going on and things that we think about. So,
oh, gosh.
Yeah, I know. It's stuff that we don't want to face and think about, but we have to. We have to, as parents, we have to have open eyes. And even though we were teenagers and we probably did some of this stuff too, we have to still be careful and be protective of our children. So one of the things I wanted to talk about is STDs or STIs, sexually transmitted infections or sexually transmitted diseases in teens. And so how big of a problem is this? Is this really even a problem at all? So, I just kind of got some statistics like, what's the percentage of high school students that are having sex? Do you have any idea?
I'm going to guess 80%.
That's wrong. It's only 46%.
Oh, really?
Yeah.
Oh, good.
And 40% of women graduate high school, which I thought was shocking, as a virgin.
40%?
40%.
When was that poll taken?
I don't know. It was just something that I found out.
In the last 5 years?
I hope so.
I hope so.
I hope so.
Yeah. It's...
So, so why is that? Why is it important? Well, okay, so it's important that if they are going to be having sex, that they engage in safe sex, because there's 20 million new sexually transmitted infections reported per year.
Wow.
20 million per year.
Wow.
Now, in that group of ages 15 to 24, so that does go a little bit outside the high school range, and it kind of really covers high school and college. That accounts for 50% of the sexually transmitted diseases.
Wow.
So if it was 20 million, so there's 10 million.
Wow.
That's a lot. And then even though they account for only 25% of the sexually active population. So they are only, of the whole sexually active population, they are 25% of it.
Wow.
But they have 50% of the sexually transmitted diseases.
Wow.
The other 50% are in the villages. Joke. It's a joke, but probably true. Anyway.
But honestly, they have to pay attention to all of this just as they're like high schoolers now.
They are like high schoolers,
yeah.
And they were from a time when they did not practice safe sex, and so they don't. So what are the most common sexually transmitted diseases in teens? Do you know what the number one is?
HPV.
No.
Herpes.
Chlamydia.
Wow.
Chlamydia is the most common. Really, about 40% of teens having sex have chlamydia.
No way.
Yeah. Yeah.
Is that a virus or an infection?
It's a infection.
So it can go away.
It can be treated and go away. Yeah.
And what if it's not treated?
You could probably get more infection. I don't know. Probably get some pelvic inflammatory things for girls. Guys can probably maybe. I don't know.
What are the symptoms of that?
Usually, discharge for male and women. You know. The second most common one is genital warts. Yes. And that's a gift that keeps on giving. That doesn't go away. And in that is HPV. So it is the second most thing. So HPV, human papillomavirus, is very common, and it's so in ages. So some of these numbers are for women because the boys have it just as much, but the women we're much more concerned about, females, because there's such a high correlation between HPV and cervical cancer. So in girls 15 to 19, 25% of them have been infected with HPV.
Wow.
And then when you go to 20 to 24, now it's up to 45%.
Wow.
And overall, there's about 7 million females that have been infected with HPV.
Wow.
So it is rampant.
But
So,
HPV has
multiple strains.
But also, I mean, there's
a vaccine.
A vaccine now for that.
Yeah.
So are these numbers going down, or?
Well, yes and no.
Okay.
So of the HPV, there's many. There's like 20 different strains, but there's the two that we're mostly concerned about is type 16 and 18. Those are the type that are linked to cervical cancer, and then there's type 6 and 11, and those are linked to the warts. So just because someone has warts doesn't mean they have the other. But when you think about it, that means they probably have a high incidence of having that because they've been exposed to all of these viruses.
Wow.
So I'm going to go through all the rest of them, and then I'm going to come back to HPV. So the other one is herpes, and that's about 16% of teens have herpes, which is that's a pretty good number, because that's another thing that does not go away. Then of the more other ones that are less, that are more we've heard of, but not so common in teens as much, and it depends on the area too. So there's gonorrhea, syphilis, and AIDS. Now, what's interesting is when you look at these numbers, there are places that, you can pull up the actual demographics of certain cities that have much higher concentrations of these sexually transmitted diseases. And one of the things that I found was I looked up the top 10 cities for infection rates of sexually transmitted diseases in teens. And thankfully, none were in Florida.
Woohoo!
Yes. Number one was, what do you think? Atlanta. Atlanta was number one. And then there was many of the ones up in the Northeast was really where all of the rest of them were. Wow. And so that's kind of the 1 through 10. Florida didn't make that ranking, at least, for that. That doesn't mean that we're clean and we're good. We just means that we didn't make that ranking. So the other thing is that teens are doing, so we talk about just regular intercourse, but teens also are engaging in other risky behaviors, or maybe they're not risky, but they are risky infection-wise. So oral sex is a huge thing amongst teens, and so that is actually one of the most common types of sex that teens are having, because they don't consider it sex at all. And so it's both guys and girls, both back and forth. And the reason why teens tend to have oral sex is kind of dumb, honestly. Interesting. The number one is pleasure, of course, of the male. But the second one that females engage in oral sex is to improve their relationship with their boyfriend.
That's the reason.
That's the second reason. And then also the third reason, these are the reasons that I found. I didn't make these up. The third one is to gain popularity. Oh, you'll definitely gain some popularity.
Not in a good way.
Curiosity. And the last reason of why they engage in is they believe it to be less risky. So is it less risky? And it is not, because really all of these transmitted diseases we talked about, all are transmitted orally. So you can get every one of those. And so oral cancer happens from exposure to HPV. And so the chances increase on men and women if you have more than 6 partners.
Wow.
I bet there are people that have done that in a weekend. I mean, as gross as that is. And so you have a greater chance for men and women.
Wow.
Yeah. And so, that's not a big number. So most oral sex is unprotected. That's just what it is. They just don't think that there's any need to do that. And so that's a huge issue there too. And I get that, but it's something that people have to be protective of.
So what are your suggestions for people who have teenagers? And you're maybe talking to your teenagers and hoping that they're not doing anything, or maybe you're not talking to them. I don't know. What are your suggestions?
Well, I want to finish up on some of these other things.
Okay.
One of the other things is And this was surprising to me, mostly just because I'm naive. And I live in a bubble, and I know that. Cynthia tells me this all the time, that I am unworldly. And even though I think I know a lot about stuff, I don't know anything about the world, honestly. I led a sheltered life, pretty much, I think. You know,
I try to shelter myself because I don't want to freaking know.
And anal sex is the other next most common thing that teens are doing. So
Teens.
And it's between 15 and 30% of teens are engaging in anal sex as well. Again, reason being because they don't consider it sex, and they don't consider that they can get pregnant, and most of the time it is unprotected.
Wow.
So that is interesting.
And are all of these STDs can be transmitted from anal sex, right?
Oh, anyway, anytime you touch it, it can happen. So people are concerned that, okay, well, I can't really get any of these things, but I think we've shown those pictures of the, of the genital warts in people's mouth, all over their tongues, all over the roof of their mouth.
Oh yeah, look it up.
We know that for men who have had exposure to HPV, that is the biggest cause of tonsillar cancer in men now. And so what's happened is oral cancer for men used to always be linked with cigarette smoking and alcohol use. That was a pretty much thing. If someone had oral cancer, you're like, how much did you smoke? How much did you drink? Now, well, we know people that, have gotten oral cancer and never smoked. I mean, Michael Douglas was the one, he had that, and he became the most famous person who had tonsillar cancer, and, he admitted that it came from oral sex. So this stuff is out there. So, although we don't think that any of this can happen to us, it gets into your system, becomes dormant, and then you have these problems. But it also happens for women as well. It's not just men. So, yes, those are the ones that it was a little bit more high correlation with, but it's for both. Now, along with this, and this is another thing that I didn't really realize, is that about 25% of teens smoke cigarettes. And I didn't think it was that high. But they do. And
cigarettes or the
tobacco.
vape?
Tobacco.
Okay, so that vaping is included in that number?
I don't know. It just said tobacco. I didn't really research
A lot of teenagers are vaping, for sure.
That's even more,
Yeah.
So anyway, I guess where I'm going with all of this, can we stop all of this? Probably not. Can we do something? But we can educate our kids to know, because, we have teen girls. We know what's going on in those schools. I mean, they are very transparent with us about what other people are doing. And it is, for people who have children and are not aware, it is rampant. Sexting is insane.
Oh my gosh.
Sending naked pictures of yourself, of boys and girls sending naked pictures to each other is super common. It's not like even anything. And all
sad.
of this stuff. It is very, very sad. It's sad how women have been so, we've made such tremendous strides to not, I can't even think of the correct word, but, I don't know. Yes, devalue them. And now, unfortunately, because of great, pressure and high school pressure, peer pressure, people are just doing it. And some of this stuff is just horrendous. I mean, they don't realize everyone thinks that, whatever boy they're with that's going to be their Prince Charming, and they send them some pictures, and lo and behold, that little asshole sends them to every one of his friends. And now, guess what? They're everywhere. And so, it's sad. It's sad to see these things happen, but they are happening every day. And, so how do we get around it? I don't know. By constantly talking about it, by telling them these things are real, and it's not good. I mean, what we've done is we've shown them all these pictures of these diseases, and yes, they're pretty disgusting, and I hope that they shock them into something. I know that it's not going to work permanently, but the longer we can get, the better,
Just trying to scare them. And
scare them straight.
Educate them and communicate and talk, and not be afraid to talk about vaginas and everything that can go on, and just not being afraid to talk about stuff. I think that's a big deal. You definitely want your kids to feel comfortable that they can come to you and say anything. Like, I heard this and I'm not really sure what that is, and not be afraid. And I think our kids are only teenagers. We're not done. But at this point, what we're trying to do is just communicate and talk about everything.
It's amazing
Everything.
because I talk to a lot of men and a lot of men who have teenage daughters, and it's the same thing. You know, when we have our daughters and they're small and we dress them up and we want them to be polite and cute and be respectful, and then all of a sudden when they turn early teens, we want them to turn all of that off. Because guess what? We don't want you being nice to everyone anymore.
Yeah.
Because nice is not good, unfortunately. And it's hard to,
yeah, parenting is hard.
Well, it's hard to do that. All right,
All right,
we'll have to come
we're
back.
going to go to break. We'll come back and talk about that bad subject.
You have a lot of choices on your radio dial. But there's nothing like talking to the GOAT.
Hi, this is Lauren Gibson from Lauren Gibson State Farm here in Ocala. During this tax season, I would like to remind you to make sure you have properly insured your assets. Do you have enough liability coverage if you were to be sued due to an auto accident? Is your home insured to replacement cost or current value? If you don't know the answers to these questions, let Lauren Gibson State Farm evaluate your coverage. Call us at 352-355-3340.
Hello guys, this is Dr. Steve Tieche from Recharge Clinic in Ocala. Guys, it's very common to have erectile dysfunction, also known as ED. About 50% of men, even as young as those in their 20s, experience this. Do you experience low energy, low libido, and difficulty losing weight? Don't be embarrassed, just get help and start feeling like $1 million again. Check out my website, rechargeocalaclinic.com, or call my office to get started, 352-512-9996, to start feeling great again.
Document Technologies has been helping Ocala business owners save money on their copiers and printers for more than 7 years. Now they've added the full line of award-winning color copiers and printers from CopyStar. CopyStar has a reputation for their overall low cost of ownership and unmatched reliability. Combine that with Document Technologies' fast, local service and 5-year guarantee. You have a combination that can't be beat. Plus, they have special programs for nonprofit organizations and government programs. To find out more about how Document Technologies and CopyStar's award-winning color products can help your business, call Bill Schroeder at 352-368-6664 and start saving today. We use Document Technologies, and so should you. Call 352-368-6664.
And in Gainesville at 372-6666.
Document Technologies, the only copier company you'll ever need.
Not all tanning is created equal. Simply Sunless is different because Sunless is my specialty. Spray tanning is all that I do. Why spend hours in the sun when you can be tanned perfectly in just 10 minutes? Hi, this is Brooke Counts, Master Certified Technician and owner of Simply Sunless. And guess what? I'm now mobile. Spend more time enjoying your tan and less time getting one. Call me at 352-843-2922. Visit me online at simplysunlessocala.com or find me on Facebook today. Tan Smart Ocala.
Great Works LLC is looking for talented people, licensed surveyors, surveyors in training, party chiefs, AutoCAD draftsmen, and rodmen to join their busy commercial surveying business. They are always looking for those with drive and passion who are willing to work 40-plus hours per week. Requirements include valid driver's license, construction experience, and the ability to pass a drug screen. Please call Chuck Counts or Ben Counts at 352-840-0086 today.
Where is it?
The GOAT FM.
Cynthia Tiche here with Dr. Tiche. We were just talking about STDs in teenagers. Not a fun subject, but you do need to know if you have a teenager that this is
Real.
It's real. It is real, so pay attention, start talking, look up some disgusting pictures, show them. I mean, they learn a little bit of this in school, but they just need to, I don't know, they need to have some goals for abstinence and try to stick with them.
The peer pressure is tremendous. It really is. And, you know, this has come for, really, when you think about it, this goes back to the porn thing, you know. I mean, when I was a teenage boy, we had no access to anything like that. You know, I mean, basically, if we could sneak a peek at a Playboy magazine, that was it. And basically all it was boobs. That's all you could see. And now anybody, you know, anybody, any age can click on, unless they have parental controls on their phone, which is still, you can't really screen it out because these guys are so mischievous. They can get their stuff in there.
Yeah.
That by that time, boys are already thinking about all this stuff. I mean, they know and unfortunately, they think that's really what sex is, and that's what they think. That's how they're going to treat women because that's how they see them being treated. The word I was looking for before is objectify, and that's really what they're going to do. And girls, if they look at it, well, and they get along with it, they think that's how they have to go as well. So people are getting this distorted view of human interaction and intimacy based on something that is totally distorted and fabricated, totally fabricated. None of it is real, and that's what they don't understand is that it's all been staged, it's all pretend,
I think talking to them and making sure that they know that these TV shows and these things are not real. These reality shows are not real. That's not the way you act. That's not the way you're supposed to act. So
one of the other things that's preventative, I talked about HPV. There is a vaccine called Gardasil. There's some other ones that are vaccines against HPV. There's quite a bit of controversy amongst parents about whether their children should get it or not, because a small percentage of people do have a reaction to that vaccine. But,
what are the risks?
I can't remember what the ones were. There was some neurologic problem that happened and stuff, but it's very effective. The series of shot is very effective of reducing the chance of cervical cancer. I believe personally, I think the risks of not getting the shot are far outweigh the risks of getting it because it is a very small percentage. Of course, if you're that 1 in 1,000, then it doesn't matter, of course, or 1 in 10,000 or 1 in a million. I agree. But, when you start looking at the number of people that will be infected, basically everyone. So, you're really trying to prevent them. I mean, everyone knows someone that's had an abnormal pap already. I mean, when they're young in their teens or in their 20s, they've all had abnormal paps. What do you think these things are from? I mean, it's not from a dirty toilet seat.
Do condoms protect against HPV?
Yes.
Do they protect against herpes?
Yes.
So obviously we can't expect all these kids to be wearing condoms because I'm sure that they're not. But
we know they're not.
But if we could push that as well, if you're going to, please at least do this. I know a lot of girls in high school are on birth control. And of course, you don't want your daughter getting pregnant. But I feel like a lot of them don't protect themselves with condoms because their biggest fear of getting pregnant is gone. So now I'm good, but you're not good. Now you have all these other issues there. They need to know that birth control is just birth control. It's not any kind of protection against any of this other stuff, which is horrible.
Right. Yep, I agree.
Yeah. Crappy
anyway,
subject.
that's my downer. Next time I won't talk about something so down. But I think that everyone, it's the school season started. I think we have to be realistic. Football games are coming up. Kids want to go to the games. They definitely want to go by themselves. Everything they want to do by themselves. And so it's just what it is.
Can we get back to talking about fun stuff like how to have more sex as an adult?
Yes. Okay.
So what else you got? You had some other fun stuff for today.
No, I don't have anything else. You have to give me something too.
Well, I had hormone questions on my list. So
your one question was testosterone cause.
And then I talked about porn.
Yeah.
So, I'm going to talk about libido with vitamins, of the different kinds of vitamins that we use to increase libido. So if you have a testosterone problem, vitamins aren't going to fix it. But we do have some vitamins that really do help with libido a lot. Tell them about them.
So the most common one is arginine, for sure. There's arginine and carnitine that definitely do that. But arginine is the most common. And we actually came up with an add-on to one of our IVs, which was called the Libido. And we actually put high-dose arginine in that. And arginine has been shown, and it's been used in erectile dysfunction, but it's also been used in female sexual dysfunction, because one of the things that it does is it helps increase nitric oxide, but increases blood flow. And so really that's what the biggest problem is with most of these problems is blood flow to your genitals. So it helps with that. And so really there are some people who, if guys are having ED and they will put them on, low dose Cialis, or tadalafil, they will put them on, several grams of arginine per day, and that's been shown to actually improve erectile dysfunction. So as an IV, you're getting a mainstream boost of it, and it does help. And in fact, some people actually feel it like right then. They like feel a little tingly sensation, and so it's kind of interesting. Yeah.
And that can help with vaginal dryness, right?
Absolutely.
I was just talking to some people about vaginal dryness. Actually, that is a big subject that I think we need to talk a little bit more about. I know we talked about that a few weeks ago, but some women are pretty concerned. And so if they haven't gotten their hormones yet and they're working on that, arginine could be a good help with that. And you can get that orally, can't you?
Yes, that's what I'm saying. They take it, they take it.
And then you can get it in a shot, an IV, and it works pretty fast that way. But what are some other things that would help vaginal dryness?
Other than hormone replacement?
No, other than vitamins. Let's talk about the
hormones.
hormones.
Well, so a lot of people, as their estrogen starts going down as they get older, that's one of the main things they start noticing. Really, less lubrication, and that's although it sounds like it's no big deal, it's very uncomfortable for many women. I mean, just so much to the point that walking is uncomfortable. Wearing underwear, if they had to ride a bike, it would be extremely uncomfortable. And they'll say they just like rubbing two pieces of sandpaper together. So really, there's topical hormone replacement that they can apply on the outside of their vagina that will help increase those receptors and stimulate stuff. There's also intravaginal hormone replacement that does it. Then there's, the patches, which on top of the skin, which, I'm not a big fan of because those are mostly synthetic. And then there's the estradiol pellets that are implanted. So all of them are working to increase the amount of estrogen that those receptors see to help kind of bring them back to life, to help restore that healthy function there. And that's one of the main ways of doing it. Really.
And what about the other subject that you didn't think we'd have time for today, but kind of is related to what I'm talking about right now?
This?
Mm-hmm.
So,
Are you going to blush?
I'm not going to blush. I'm just going to say...
You look like you are.
No.
Is his face red?
No, it's not red. Well, I came across... When I'm researching these things, there'll always be like a reference to something else. And of course, being like a cat in a string, I get distracted. So I go on to these other little topics and kind of read about them. And so one of the things when I was actually working on some of these different things, I came on to... So men always obsess about their penis size, shape, all of that kind of stuff. And that's the big myth is, making their penises bigger, all of that craziness. So I wanted to see if there was the female equivalent of that. Do women obsess about their vaginas? And there was a thing that I came across was right in the top of this thing was that Beyonce was still working on her fupa, but she had gotten accustomed to it.
Wait.
So,
for those of a fupa? What's a fupa?
So women who gain weight or, and some women just naturally have this, they have an area of fat above their clitoris, and that's just called the mons area, the mons pubis area. And the fupa is kind of a derogatory term. It's called, fatty upper pelvic area is one thing that you could say, but you could say something a little more derogatory, which I won't say. And so she has not gotten rid of that after she's had her kid, and she's embraced it. So anyway, that led
So
me
now
to
we're
think
talking about Beyonce's fupa. Just to be clear.
Just to be clear, yes. But anyway, we then went to, well, that brought me to the thing, how do women view their vaginas, and are they happy with, do they think that they're, do they have the same issues that men do as far as...
That's a good question.
Do women have the same issues with that men?
So let me guess, because I don't know what you researched. I'm going to guess no, that they aren't as obsessed.
Well, they are not as obsessed. You're right. The percentages, but the percentages that yes, many are. Many are concerned with how things look. Is that whatever their appearance is? Because there is a wide variety of appearances.
Lots of different ones.
Lots of different, and they are all normal variants. So there's nothing abnormal.
Just because yours doesn't look like that one doesn't really matter.
Of course, people wonder if that is normal because they may not have had that. So that's So yeah, they are. They are concerned.
So
then that goes on to the next thing that I scanned over to is this is, one of those things that just came up, and how do people think? Do women feel like they have a loose vagina? And so, does vaginal size change with age?
Does it? I'm sure it's got to.
It does. It does to a small extent. So the things are, they're, the questions that they raised were, does having sex make your vagina stretched out and bigger? And the answer is no, because it's really very elastic. So the things that do are, as you get older, some of the muscles that surround it loosen and weaken, and so that does, to an extent, just because that muscle tone is lost, and some of the hormonal effect is lost. And then pregnancies and childbirth does stretch things out a little bit, but it does and can come back with
like Kegel exercises?
Kegel exercises, which then brought me to the next step up of crazy things of exercises that women could do for vaginal
So everyone
tightening.
knows what Kegel is, and if you don't know, that's just tightening, like when you're peeing pee stop, or just tightening throughout
and
the day.
men can do that as well.
And those are very good to do. It helps with incontinence and keep all of those muscles and everything. We're out of time.
Well, that's good, because I'm going to have to go back to the other exercises, some of which are quite shocking.
Really?
Yes.
Oh, a cliffhanger.
Yeah,
a cliffhanger. Check out our next show if you want to hear about the vaginal exercises that are shocking.
I think they are.
I don't even know what they are. Are you going to tell me?
No.
Okay. Thanks for watching. We'll see you next week. Hey, this is Cynthia from Recharge Clinic. You need to come by this summer and get one of our amazing vitamin IVs. Dr. Tieche has made a great cocktail that's going to help you have more energy, lose weight, a better libido, and even sleep better. Come see us at Recharge Clinic, 47 Southwest 17th Street in Ocala, Florida. RechargeOcalaClinic.com. That's RechargeOcalaClinic.com.